A trip to the doctor can help save your life, but some men are playing a dangerous game of chance. Thanks for staying with us. I'm Tamsin Fidel.
And I'm Erin LeBeau. So a recent survey found that most men refuse to go to the doctor because they think they are healthier than everyone else. But here are the facts from the CDC. In fact, 13% of men are considered to be in fair or poor health. 40% are obese, and more than half the men in this country have high blood pressure.
Yeah, and yet a third of men in the U.S. do not feel the need for annual screenings. 65% say they're healthier than others. Joining us now to talk about all these numbers, Dr. Louis Cavusi, the chair of urology at Northwell Health. Doctor, thanks so much for being with us this afternoon.
Thank you both for having me.
Well, so let's dive in because some of these numbers are pretty staggering. Why do men skip medical checkups even if there's something wrong?
Well, the guys in the audience will understand that guys are guys. And it's a guy thing. And I think it's a combination of factors. There's a pride, there's a machismo, and I think there's also a fear that suppose they may find something, and we all have this ignorance is bliss, and maybe it'll go away. So, for multiple reasons.
So what are some dangers or problems that can happen with delaying these regular checkups?
Well, it's always better to pick up something early. And an example I'll give is you having people over for dinner, you have wine on the table, you spill the wine on the table, you want to sop it up right away before it starts rolling down the legs, getting on the floor, and making a mess that you can't clean up. The same thing with a lot of diseases. If you catch it early, your chance of beating it and living a long, healthy life is much better.
Analogy.
Maybe if you give an alcohol analogy to men, more of them would go to the checkup. Who knows? I'm just trying to help. Let me ask you this. There have to be some health issues that don't have obvious symptoms out there, but a doctor would be able to catch. So what are some of those?
I think early on, most do. So with blood tests, you can pick up things like diabetes, problems with your thyroid, problems with your testosterone, men. You know, that can be an issue. But heart disease, many cancers, going to the doctor, picking it up early, getting it treated early is what you need to do.
So almost 40% of men in this survey say that they get their medical advice from social media. What are your thoughts about that?
Yeah. So I think an analogy to this is, would you take advice from the folks you went to grammar school with in the playground in terms of health? No, that's essentially what social media is. It's great because it's everybody. And it's great if you're going to do home improvement projects, and we all do that. Look at it. But medicine and healthcare is so much more complex. And then there are different agendas people have on the on social media that may drive one direction or another.
What about from Dr. Google or WebMD?
You know, there's some good sites on there if they're a government site, .gov, or professional organizations. But a lot of things are hidden in advertisements. You got to be really careful. And again, discuss it with your doctor. If you see something, a good physician won't mind being challenged by what's on the internet and to address it with you, why it may or may not be right for you.
Yeah, no question at all about that. Well, let me ask you this. So there are some disparities at work here, right? A Kaiser Family Foundation survey found 15% of Hispanic men have not seen a doctor in the past year due to cost. So that's more than double white men. How can we fix something like this? When we look at these numbers and we look at the different percentages there, it's understandable why some men are not seeing doctors.
No. It can be very difficult, especially if you don't speak English, and there are a lot of people afraid of going because of citizenship, not being citizens. There's fear in terms of not understanding.
Or cost.
And the way to fix that is fixing it. We need to have more people speaking Spanish in office, more of the forms in not only Spanish, but in the New York metropolitan area, you could have hundreds of languages, and we need to do our best to try to make patients feel comfortable in terms of going to the doctor and doing this. I think a big problem is that, and they don't know how to navigate resources. There are a lot of resources that the government has for people to get their health care paid for. It's just difficult, especially if it's not in their native language. And there are social workers who can help with that.
All right, doctor, we're already going to use your analogies, but what are some ways that us ladies can help the men in our life take more responsibility for their health?
Keep nagging. So I see the most common reason that men come to see me are because their wives wouldn't stop nagging. And thank God, or their
You're going to keep
significant
using that
other.
word, huh?
Right. But it is true. But help make the appointments and say, look, I made an appointment. It's important, I think, if they accompany them to the appointments,
Oh,
because
that's a good one.
sometimes we don't, all of us don't hear. And I would even say for the ladies, it doesn't hurt bringing somebody with you to an appointment, especially if you're getting some complex news or whatnot. Have an extra pair of ears to hear about it, and especially if somebody who cares about you. If they care enough about you that they made your appointment for you, they're going to listen up and really try to help you listen to what your mom said. Eat your vegetables.
All right, Dr. Fauci, we'll stop nagging you, but we will make sure the men in our lives are at the doctor. Thank you so much. I think it's such an important topic, though, really, because we talk about a lot of studies involving women, but you know, maybe not as many involving men. So this is a good topic for sure.
I appreciate the time. Thank you both very
thank you.
much.
Good to have you.
And love your program. Thank you.
Thank you.